Hi everyone, welcome to this fortnightly Tools of Frontline Staff session. We've got three presentations today. Ramika is here from the council to talk about care charges and the support available around those charges. Bastier is here to talk about accessible communications, and then we've got Tom from the council's grant service to talk about the new VCS grants programme. So I'm going to hand over to Ramika. Thanks so much for coming along.
Great, thanks. Hi everyone, my name is Ramika and I manage the payments and care charging team in Adult Social Care Finance. So John has asked me to speak with you today about care charges. So hopefully by the end of this short presentation, you'll have a better understanding of what care charges are and the support available for completing financial assessment forms. Right, I'll begin with an overview of care charges. So the care charging team is responsible for delivering Hackney Council care charging policies for both residential and non-residential care. So residential care charging is governed by the Care Act 2014 and follows a standard national framework used across England. Non-residential care charging, which includes things like home care, direct payments and support in the community, is also governed by the Care Act 2014. However, unlike residential care, there is more flexibility for councils to develop their own local policies. So here in Hackney, for example, we have a cap on the maximum we can charge under non-residential care services, which is £250 a week. So our team works to ensure that all charging processes are fully compliant with the Care Act 2014 guidance, as well as with Hackney's corporate and local procedures. So what are care charges? So care charges are contributions that services may need to make if they are in receipt of a chargeable social care service. In Hackney, care charges are determined through a financial assessment. It is means tested and based on an individual's income, benefits, if they've got any savings, assets, and essential expenses. So I've got a list of like chargeable care services. So you can see there's home care, direct payments, daycare, supported living, housing with care. So they all come under non-residential care services. And then you've got residential placements and nursing placements that are also chargeable. There are some people who are exempt from care charges. So if they are under Section 117 of the Mental Health Act, if their care is fully funded by the NHS, then they would not be required to contribute towards the cost of the service. The next section is the discussion around care charges and completing the financial assessment form. So I've broken it into two parts. So when a care package has been agreed, the social worker is responsible for discussing care charges with the client and informing them that the care service is chargeable and they may be required to contribute towards the cost of their care. So they will leave behind the charging documents, including the financial assessment form. Then the client or the financial representative is responsible for completing the financial assessment form. They'll need to provide details of their income, if they've got any savings and any relevant housing cost. They should also provide any supporting documents that the council asks for. So now I understand that it's not always easy to complete the financial assessment form, especially when they don't have a family member to support them. Sometimes they may not have the correct figures or they're not sure how much they receive on a weekly basis. We get many of those cases, to be honest, and it's completely fine. Our advice to them or to anybody helping them to complete the form is to complete it to the best ability. We have their personal details and the form has been signed, then it gives us permission to verify the financial information against the DWP system and carry out a financial assessment based on the information we have. So once the financial assessment has been carried out, we'll write to the client and then we'll inform them of the outcome of their care charges. It is very it's very important for the client to complete and return this form, because if they don't do this, we'll carry out an assessment based on the information we have. So that will be the DWP system and information from internal departments like council tax, housing benefits, or we'll try and get information from various departments. But this could mean, they're charged more than they need to pay under the council's current policy. So that's why it's really important that if they are in receipt of a chargeable service, that they complete and return the financial assessment form, so that we can make sure that we've got the correct financial information and that the person has been asked to contribute, based on what they can afford to pay. So how it usually works is, when the social worker leaves the financial assessment form with the service user or the family member, they've got 14 days to complete the financial assessment form. If we don't receive the form back within the 14 days, the care charging team will send out 2 sets of reminder letters to the service user. And if we still don't receive the form back, we will then go ahead and carry out an assessment based on the information that we hold. And we will then write to them to let them know that this is what their care charge will be from so-and-so period. Right. The last slide is on what support is available. So we have a dedicated telephone line and mailbox. Service users can use these to ask questions or get guidance directly from the care charging team. We've got a welfare benefit officer who's available to provide advice and support on benefits that service users may be entitled to. As a council, we've published a range of information to help clients to the process, including information booklets and online resources, which you can find on the Hackney website. We can also help clients access other services that provide advice and information on a range of financial needs, such as managing debt and paying for care. They can also access free, independent, confidential advocacy services to an organisation called Rethink. And all these details can be found on our information booklet and also on our Hackney website. That's the end of the presentation. Happy to take questions, or if you need clarity on anything that I've just discussed. Yeah.
Thanks, Ramika. That was really good, really clear, really helpful. Yeah, does anyone have any questions for Ramika while she's here?
And it would be good to know the sort of audience because I feel like you've got a mixture of different people today, so it will be nice to know. I know there are a lot of people that are probably here who support residents with completing financial assessment forms and things like that, so it'll be nice to hear from people.
Yeah, great. Maybe if people could introduce themselves and what their organisation is when they ask the question, that would be really helpful. Alex.
All right, thanks, John. Thanks, Ramika. So I'm from Hackney Food Bank. So part of the thing we have obviously worked with a number of partners, addressing why people end up needing emergency food. And one of the things that have come up is
your audio is a little bit muffled, Alex, and a bit unclear.
I'm just going to turn. I don't know if it's. Oh, was it everybody? Okay.
My project. Is that better?
Yeah, a little bit. Yeah.
Okay, I'll try and shout in my office. It's echoey. I'm really sorry.
That's all right.
So what we're looking at is people who have the letters. Obviously have come out of hospital quite stressed, don't necessarily complete the form on time. They've got the maximum charge. Once they've had the maximum charge, can things be returned? Is there a way of appealing? How do we sort of go back about backdating these problems so people actually get charged the correct amount if the form has been ignored for a variety of reasons?
Sorry, I only got bits from. I'm not sure if someone can repeat Alex's question to me. I think I heard about the 250 max charge, and is your question on whether if we've assessed it?
Sorry, Ramika, go on.
No, that's fine.
My understanding was that it was if people are getting charged the maximum amount,
yeah,
but it's incorrect because for whatever reason they feel they've either not filled out the form because they didn't understand it, or because they filled out the form, but it wasn't responded to or accepted or something like that. So how can they go about challenging the decision to pay to charge them the maximum, and would it be possible to backdate it, is my understanding.
Yes, of course, yeah. So if they are charged the 250 maximum charge, or it doesn't have to be the 250, it could be if they think that the charge is incorrect, then it's important that they complete the financial assessment form so that we can carry out an up-to-date financial assessment. And if their care charges are lower than what was set, then we would obviously backdate to the start date of when we started charging them. So yes.
Thank you, Ramika.
Thanks, Alex.
Thanks, Ramika. And thanks for the question, Alex. I think I've got Krista next.
Thank you. I've got a question actually about a resident referral that I had this week or last week that I've been working with Age UK, but they didn't have much to offer on a point. Where do we go if a person needs a financial reassessment urgently? So I've got a resident that's being really overcharged for the services that's being delivered, and he's just had a 10-12 grand bill sent to him in the post that he knew nothing about, and this is a resident on every potential low income and sort of inequality that there could be. So where should I direct it, because I've been really struggling to find anywhere to link into in ASC to get a response?
You can if I just share my screen again, so he could either, is he able to send us an email? So he can email
definitely.
us. Okay, so he can email us at the care charge. This is our care charges email address. I think, John, will you be sharing this presentation with everybody?
Is it care charges all one, or is there a dot in the middle? Sorry, I can't see
care
it.
charges, yes, all in one at hackney.gov.uk.
Okay,
I'm sure I'll be able to. I can share the. John, you might be able to share the presentation with everybody.
Yeah. If you said, I can put it in the newsletter.
Yeah.
Okay, perfect. Thank you. Thanks so much.
So if you can just make sure he's got, we've got details of his name, his the reference number, and then and then just like a brief description of what the issues are, we'll be able to look into it, and if we need to reassess them, then we'll be able to do that.
Yeah, I think he definitely needs a reassessment. His care plan definitely needs redoing from top to bottom. All right, amazing. Thank you so much. Thanks for that. Thank you.
It's okay.
Thanks, Krista. Batia, I think you're next.
Hello?
Hello.
Yeah,
Oh, okay. Hi, Ramika. You've dealt with so many times over the years. I'd like just to raise the point that the way that care charges are invoiced and the invoices that are sent out is not particularly user friendly, and I'm wondering if there's anything that can be, if there's anybody that's interested in doing something about it.
Right. Yeah. So it's not. No, we've heard that from many people. It is something that we've flagged up with our sort of financial assistants, but there's nothing that can be done in the interim. But it's something that we've flagged up. I do appreciate that the invoices and the statements are not. They can be quite confusing to our customers, and we do tend to get a lot of like calls and emails, so that because they need a bit of explanation in terms of how we've invoiced them. But it is something that we've raised, Betty, already with our financial assistance.
I mean, the other thing is the people that send out the invoices are not you. It's something.
No, so it's an external provider,
and that really is not helpful in terms of getting paperwork done.
No, I appreciate
I mean, even something as simple as a change of address can go totally pear-shaped.
Yeah,
I mean, everything else is private client stuff, but these are the general points out of all the people I'm dealing with. And it makes my life very hard when, the responses are so slow. I mean, as fast as I deal with something, more stuff comes in. And it's sort of a headache when all what I'm getting is a lovely email from a member of your team saying I've passed it up to the next team, and then deathly silence for weeks.
Yeah.
And in the meantime, the bills are building up. It's not like they go away. They get bigger and bigger the more you ignore them.
Yeah, I mean, Betty, I'm more than happy for you to kind of, if you want to share the details of myself, I can.
Okay, I will do that, because I think I've got a couple where it's getting particularly ridiculous, and I'd be grateful for some support. Thanks.
No, that's fine. No problem.
Thanks, Betty. Yeah, thanks, Ramika. Does anyone else have a question? I think Jitty or Gitty, you had your hand up, but it's down now, so maybe your question's already been asked. But yeah, does anyone else have any questions for Ramika while we've got her here? Joycelyn.
Yeah, thank you. I have a client that have council tax over £2,000, and he's really struggling. So I don't know if anybody can help me to signpost him to you.
So was that council tax?
Yeah.
Right.
So,
He's on universal credit and PIP, but I don't know how he end up with over £2,000 council tax.
Right.
A lot of happening around him. And
if it's just to do with council tax, Joycelyn, do you want to email me and I can?
Yeah, you'd have to
I can work out where I can direct you to.
yes,
Is that right,
please.
Joycelyn? Yeah, just email me and I can look into that.
Okay. Thank you.
Any other questions for Ramika? No. Okay. Thanks so much for coming along, Ramika. You're more than welcome to stay for the rest, but don't feel you have to. But yeah, I'll be putting all of Ramika's slides and everything in the newsletter for everyone, so you'll get all the information there as well.
Great. Thank you, everyone. Thanks for having me. Hope you all have a lovely evening.
Thank you. Cheers.
Bye.
So we are going to move on to the next item, which is Batia is going to be talking about accessible communications. You're still there, aren't you, Batia?
Yes, I'm still
Yeah.
here.
Great. I will.
Sorry,
I was looking on my screen. I couldn't see your name anyway. I will share my screen, and you just tell me when you want me to move on.
Right. I mean, I'm going to whip through it fairly fast.
Yeah.
This was a co-production with the Community Health Champions. So it's only very swiftly the first 32 slides, but you will see as we go through that, you know, they're sort of in bunches of 4 or 5 making the same point. It arose out of PowerPoint presentations, leaflets. I'm not going to name and shame anybody. These are all made up examples in the slides. But along the way, I found out that there is an international standard on universal readability. So that's what these slides are about. Next slide. Okay, so that was part of the Community Health Champions Communication Toolkit. Next. So we are trying to very simply understand the factors in visual accessibility and look at the best practice guidelines and some of the tools there are. Next slide. Yeah. So when you're looking at it, you look at the font, you look at the layout, and you look at the color and color contrast. And that's the bit where I've quite often made noises about things, John, because the color contrast is particularly affects older people in general. The color acuity slides a bit as you get older. And obviously anybody who's, well, I'll get onto that. Next slide, sorry. Next slide. So for font, you look at the size, you look at the type of character, the style, whether you're using Arial, New Roman, or if you're using a fancy one, and you go for consistency. So within one paragraph, you're going to use the same font and the same style. Next. So font 12 point. That's the general one for print to make sure everybody can read it. And for digital, more like 14 point. Next. So you choose something familiar. At Times New Roman or Arial is pretty good for everybody, but you go into something like a font script, and as far as I'm concerned, that says mice have a rice day, which isn't very helpful. I've then got to say, no, that obviously isn't what it says. What does it say? And, you know, look for another pair of glasses, a magnifying glass, which doesn't help. Next. And characters that resemble each other. So in some fonts, L and 1 that just don't look any different. Next. So then there's the illustration. The Arial is nice and clear. The script one is not clear to everybody. And the Garamond is also not as clear. So it's testing out the font styles together with the style that you want. Next. So you don't want to use too many italics because they are lighter than the script. So it might just look like a grey blur on the background because the italics are lighter than the normal script. But all capitals is generally a no. Not too much underlining because that can also get in the way of deciphering. And again, bold when you really need it and not otherwise. Next. No more than 3 fonts in a document and the same font for every section, which I've already said. Next. So you're looking at the format, the line and letter spacing and the alignment. Next slide gives you some examples. Next. So consistent and don't mix and match font sizes. Next. So line spacing 1.15. In other words, you don't want your lines right next to each other. And then there's something called kerning. Kerning is the space between each letter. So the first example is nice and clear. The second one, the R and the N run into each other. It might say Kemming. It might say something else because they're too squashed together for everyone to read, which is what we're aiming at. Next. There isn't, I mean, it doesn't really matter with alignment, except that if you justify right, it can make it hard to find the beginning of the line. So left is fine or justify is fine. Next. The Ishihara test. This is how people test for color blindness. These are just examples. They're not, you know, you wouldn't use it yourself. But for example, when you're shown, say, about 50 of these, there'll be some that you may not be able to distinguish the number from the background. Next slide. And just in case you were wondering, these slides are labeled to tell you what number is actually in there. But if you say you have a leaflet, which is, for example, blue with blue writing, somebody with any of those particular visual difficulties might not be able to make out any sense of it at all. Next. So the difference between the foreground, the writing and the background color is important. So black on white is 21:1. And then there are Web Center accessibility guidelines on these things. So you can all look those up. Next. So it says where to find the different colors. Next slide shows you which ones are best. No, sorry, gives you their names. Next slide. Oh, I thought there was another slide in there. It says how to test color contrast, and it gives you a website address. Next. There should be one with them crossed out somewhere. There we go. So you can see the more pastel ones are crossed out because you get better contrast from the bolder colors. Next. Next. Okay, so this one is not actually, only the bit that says illustrations by Sarah is actually easy to read. The top bit being in script is hard to decipher, and the bottom bit, whilst it's clear, the clouds and the colors in the background are getting in the way. Next. Next. I mean, there's supposed to be examples of bad graphic design. Now this is exactly, I think, what one meeting I complained about, John. It's unreadable. I am absolutely myself unable to read white on blue. And I definitely can't read white on green. If you send me anything like that, I'm at a loss until I run it through my computer and say, change the font color, change the background color, which is complicated. Next. Okay, what would you change in this to make it more readable? Have a think. You can see some of it is too small, some of it is white on light green, and there are lots of different, there are 3 or 4 different fonts in it. It's not going to, somebody's not going to be able to pick it up and go straight away, I can find the information I want. Yeah, you're right, Rachel. Not so many boxes. Next. Next. Okay, again, another one. What would you change? Well, the top left corner, forget it. The white on green is fine if it wasn't in script. You see what I mean? It's like, you know, once your brain knows, you begin to pick up the little things that you can change. Next. That's it. That's the end of those slides. I hope that's all given you something to think about. And if anybody if John, if you wanted to ask me which council leaflets are completely unreadable, I think I've already told you about those. But I mean, the point today was to say to people, before you produce a flyer, if you can't do it yourself, ask somebody these obvious questions, or ask someone who has training and expertise in this field to have a look at it and say, yes, that's nice and clear, I reckon everyone can read it, or that's really pretty, but it doesn't do the information giving job that you want it to do. It's a balance. Thank you, John.
No, thank you. I feel like I learnt loads in 10 minutes. That was fantastic. Thank you so much. I was just going to go to the chat because, yeah, I was going to sort of ask the same point, Rachel, around whether our design team are aware of those slides or whether they helped, or how we can.
I'm terribly sorry, they are not aware.
Okay.
Seriously, I've done co-production on one lot of council leaflets.
Okay.
And we are still getting things that are not universally readable.
Okay, thanks for making that clear, Batia. We will make sure that we make sure design are aware of them and see what we can do to improve that situation. Jonathan has put in the chat he's reviewing and amending some council tax notices, so he's going to take on board that advice. So that would be brilliant. Thanks, Jonathan. Yeah, and good point, Charlie, as well, about sharing with design for anything we do going forward. Does anyone have any questions or feedback or anything they wanted to raise around accessible commons in general, or a question for Batia? No? Okay. Oh, Charlie.
Thank you for the presentation, Batia. We've spoken also in the past about how is it helpful to render accessibility for venues on publications as well, because we know that that's not consistent across publications, and that has caused a frustration in the past for users when something is labeled as an accessible venue where it isn't in reality. Is there any kind of universal thinking around that you can share?
Well, the UK guidelines are part 21 of the building regulations section M, and boiled down to one sentence, it says that all buildings should be fully level access, and that is you apply the shuffle test. Put both your feet firmly on the ground and slide them forward one at a time without lifting them at all. If you encounter an obstacle, then the venue is not fully accessible. I mean, it means someone in a manual wheelchair will be bumped up and down and over it, and a baby whose brains will rattle in their skull. And a power chair, depending on the power chair, may or may not be able to get over that. And I'm sorry, I'm very hot on it because my insurers tell me if I do anything stupid, my insurance is invalidated. And therefore they won't pay out if my wheelchair is damaged on, say, a metal sill that shouldn't be there. I think the other bits about accessibility, Charles, is basically all entry buttons should be within half an arm's length of the door and at waist height. I mean, it's no good there being a beautiful disability entrance if the intercom is at head height, and I mean standing head height, on the side panel, way out of reach. And I'm supposed to sit there and, you know, knock on the glass door or wave my arms until someone notices me. So it isn't just about whether it's actually accessible. It's also about how do you get in? How do you tell someone you're there? And Rachel knows I've done the how to audit places training with her. And I'm always happy to be asked to, you know, review somewhere or look at it. And yes, it's very sad that places think they're accessible and they aren't.
Thanks, Charlie. Thanks, Batia. Does anyone else have any other comments or questions? Thanks for your comment in the chat, Krista. No? Okay. Thanks again, Batia. Really great presentation. And yeah, we will try and disseminate all of those slides and the important information in them around the design team at the council. Tom is here from the VCS grants team at Hackney. So I'm going to pass across to Tom to talk about the new grants programme. Thanks, Tom.
Hi, thanks, John. I'll just start loading slides. There we go. Sorry, it's being a bit slow for me today, but hopefully it won't cut out as it has done through one presentation. But yeah, we'll see. Yeah, basically we've launched our grants, our VCS grants program this week. It went live on Monday. We're basically, yeah, there's a few different programs available. They're all different to what's happened in previous years and different kind of guidelines, etc. There's a lot which has remained the same, but some significant changes. So we'll go through the basics of it here, and if you have any questions, obviously you can ask here, but we're happy to answer any questions going forward because you know it can be a bit of a change from what's happened previously. So overall, it was really important for us that we translated what we're trying to achieve through the refreshed voluntary and community sector strategy, which went hand in hand with our new grants redesign process. This is looking into how we invest in the voluntary and community sector through our grants. The approach we took was to develop a set of principles that would ensure that we were doing this building on engagement undertaken with partners in the autumn. We co-designed a set of principles with sector partners in the workshops which we ran in spring, and these are the principles which are in place to guide who, how, and what we fund. So the overall principle is to support and strengthen communities and tackle entrenched inequalities as a system. And to do that, we want to fund in a trusting and enabling way that strengthens organisations to invest in ways that help us all to continually learn and work together as a system, and to direct resources to focus on organisations and communities that have been failed by the system. In order to invest in a guided way by our principles and based on learning from our own work as well as the wider sector, we put in the following grants programmes in place, which we'll talk a bit more in detail later on. The grants programmes are a core grants programme, a project innovation fund, VCS infrastructure grants, and we've also got a collaboration and co-production fund, which we're using to make sure that smaller organisations are able to take part in our processes, whether it be as assessors or any other way of contributing. It's basically just to compensate for people's time and make sure that everybody who wants to get involved with the programme is able to. We also got the Healthier Hackney grants, which we're running in collaboration with Public Health. These are similar to Healthier Hackney grants, which have run over the last few years with a few changes based on the learning from the past few years. So our core grants programme is based on learning from other funders, sector more widely, and our own grants programmes. Most specifically, in the past few years, our advice programs, community infrastructure, and lunch club grants. We want to fund organisations' purpose rather than projects, which is in line with our grant principles of funding in a trusting and enabling way that strengthens organisations. The core grants will offer organisations core funding for up to 5 years to support organisations who are supporting residents who are at increased risk of harm due to entrenched inequalities, supporting residents in a person-centred, trauma-informed and anti-racist way, and working in collaboration with other organisations across the system. This is our largest grants programme, and going forward will be around about 1 million per year will be invested in this way. The application process will be a 2-stage, which will include an expression of interest form, followed by a more in-depth application. The deadline for expressions of interest is the 15th of September. We've also got our Project Innovation Fund. This is based on learning from our Project Grants and Community Chest programme over the last few years. And we're moving towards more core funding generally. We recognise that short-term and project funding can support innovation in smaller organisations, which is why we get some project funding within the programme. This funding will be for short-term projects of up to 12 months with grants of up to £10,000 available. It's funded specifically for smaller organisations with an annual income of less than £250,000. Projects will still be expected to work towards the grants principles, which say a strong focus on tackling inequalities. This year is £100,000 available for this fund, and we'll have 2 rounds of funding, but this will be significantly less from next year and beyond due to savings we have to make. The deadline for round 1 of this is 15th September, and the second round will be launched later in the financial year, likely to be early next year and prior to April 2026. We also got the VCS Infrastructure Fund. This is to make sure we are committed to ensuring that there's an appropriate future-proofed and adequately resourced support system for voluntary sector organisations. This is to help people access capacity building and volunteer support. This year, we're continuing to fund Hackney CVS, the Interlink Foundation and Volunteer Centre Hackney, whilst aiming to better understand the needs of the sector going forward. Our aim is to relaunch this infrastructure programme in January 2026, with new grants available from April 2026. We've also got the VCS Infrastructure Black and Global Majority pilot. As part of this, we'd like to work with Hackney-based Black and Global Majority-led organisations to develop an infrastructure programme for smaller organisations which considers the following and how in the current system it has been shaped by colonialism: capacity building, Black and Global Majority leadership, networking, networks and advocacy, and volunteering. It's recognising that infrastructure and capacity building support needs to understand the barriers and systemic inequity organisations have faced, continue to face, and the Black and Global Majority Infrastructure Grant, which will test this year and then incorporate into a wider programme for 2026 onwards. This will also be a 2-stage application process, which will be an expression of interest form followed by a visit to the shortlisted organisations. The deadline for expression of interest is 4th of September. And finally, we've got the Healthier Hackney Fund. This is, as I said, run in conjunction with Public Health and based on previous Healthier Hackney grants. The purpose of this is to fund innovative community-led projects that help Hackney's inactive residents to form and sustain healthy movement habits. VCS organisations rooted in Hackney can apply. They must serve at least 80% Hackney residents, be user-led, partnership-based and culturally responsive projects will be prioritised. There'll be a few different funding streams. There'll be a generic grants pot, family play, older adults, which are defining as age 50 plus, and some smaller activation grants. They're looking for projects that embed activity in everyday life, creating and sustaining healthy habits, partnership and peer support, use of local space and assets, as well as social connection alongside movement. This has a deadline of the 15th of September, projects looking to start in November 2025. For all of these, there is guidance and document links on the website, which I'll put in the chat after this. All of the applications have opened, that says today. It was on Monday, so 3 days ago. The table outlines the deadline for each of the programs. So we've got core grants with the expression of interest deadline is 15 September. Project Innovation Fund with the application deadline is again 15th of September. The Black and Global Majority VCS Infrastructure has a slightly earlier deadline of 4th September, and Healthy Hackney is also 15th of September. General eligibility criteria have remained the same as previous years, namely organisations must be a registered voluntary community and social enterprise organisation operating at a local level in Hackney, or they can be an unregistered but formally constituted voluntary community and social enterprise sector organisation operating in Hackney with a bank account in their name or a host organisation to support them. Also be a registered charitable company or social enterprise with a registration number on Companies House or Charity Commission. Companies must have asset locks and be wholly not-for-profit without share capital. For the Project Innovation Fund, we also accept applications from tenant and resident associations and groups of residents. Private businesses and individuals are not eligible to apply for grant funding from this programme. If you are interested, do have a look through all of the eligibility for all of the applications. This is a general overview, but if you're unsure whether you can apply or not, or want to clarify, do get in contact with us, because we'd rather speak to you about that rather than just assume that you can't apply. Generally, we need at least 80% of the people benefiting from the funding request must be Hackney residents. Priority will be given to organisations who are user-led or have a strong commitment to involving beneficiaries and using lived experience in the design and delivery of the programmes. Priority will be given to organisations based within Hackney, but some income restrictions are applied for specific funds. And it's also highly unlikely that we'd give organisations a grant via more than one of our funding streams. But if you're unsure about this, please do contact us to discuss it further. There's a few other small changes. Look, we've got a new application portal and new login procedures. There's guidance to support with this. Got simplified due diligence procedures, which means we'll be asking for fewer documents at the start of it and trying to streamline the process so you don't have to submit so many documents. If you are successful, you might be asked to submit more documents, such as like safeguarding or insurance documents as well. There'll be increased focus on the equality plan alongside the new grants principles to help inform our decision making. As well as mentioned earlier, the collaboration and co-production fund is in place to support smaller organisations take part in our assessment process. It's also worth noting, like many of the teams across the council, our service is undergoing a restructure, and there may well be significant changes to the team over the coming months. We'll keep you updated with this, and whilst this won't affect the programmes, the overall bits of the programmes we're delivering, it may affect who you work with or who is supporting with this, but we'll keep up to date, and it's important to us that we're supporting groups going forward. Just to say, we're expecting the programme to be very popular this year. It's in previous years been heavily oversubscribed. We've generally had a 20% success rate, and we're expecting it to be more competitive this year. There's been a reduction to the grants programme, which means there's less funding available. We've had a roughly 35% cut to the grants funding programme this year, which has informed why we designed the programme to make sure that we're trying to meet needs as best as possible with less money available. We have to make sure that our funding supports people living in difficult circumstances at risk of significant harm affected by entrenched inequalities, as per our grants principles. And we would encourage any organisations to speak to us in advance of making an application if you have any questions around this. Lastly, next steps, I would have a read of the prospectus and the grants guidance documents, which is on our website. We've run all of the online information sessions this week, but if you missed any of them, we'll be putting them up on the website in the next few days. If you want to see those, which will be on they'll also be on the council YouTube channel as per this. Have a look at our FAQs about changes to the programme and contact us to speak to a member of the team about your ideas before applying. There'll be additional application support through Hackney CVS and East London Business Association. If you have any, they'll be able to help with applications as well as any other questions that you might have. You can also sign up to be part of our assessment process. It's really useful to have lots of different people come on our assessment process, especially people working from voluntary sector organisations and working directly with residents. We try and get a diverse range of people from the council, from VCS organisations to be able to assess the application, so that you have a good range of ideas and how this would work. What constitutes a good application. We also got there's other council funding available at the moment. Example, the Civil Community Fund. This is running separately to our programme, and if you have any questions about that, do go to the neighbourhood CIL team, which contact is below, and they'll be able to help with that. We generally run along the same kind of principles, but their programme is quite different to ours. So do have a look at both of these options as well. We've also got updated discretionary rates relief application, which is available on the website. If you want to contact us, this is the addresses to contact us on. We've got the email or phone number, and as well as have a look on the website, which has all the guidance documents and such like on there. We are working through emails at the moment. We've had quite a lot of correspondence this week from launching it, but if you email us, we will get back to you as soon as we can. We're just working through all of the questions, and if you want to have a phone call, either give us a ring up or drop us a message in the email, and we can give you a ring back. That's everything from my side. So if anyone has any questions, please go ahead.
Nice one, thanks, Tom. That was really clear. Charlie.
Sorry, Tom, I might have missed it. Does anything preclude an organisation for applying for multiple streams with the recognition that they might not get awarded multiple streams?
No, there isn't. I would say, just to make sure that to have a look at all the guidance and make sure that groups feel like they have a good chance of meeting the aims and the priorities within each of the streams. It might be. We just generally don't encourage people to do more than one, and to kind of look at the guidance beforehand, because we don't want people to be spending a lot of time on something which they might not be successful for, and to spend more time on one application which they have a better chance at getting.
That's completely fair enough. But if, say, an organisation was really splitting hairs between two approaches, they couldn't decide in that instance, that would be fine. Okay.
Yeah, that would be fine. Also, yeah, if they have any questions around it, we're happy to kind of roughly direct. It's up to the organisation themselves to make a decision, but we're happy to kind of give any guidance around that if people are unsure as well.
Great, thanks, Tom. Thanks, Charlie. Any other questions for Tom? No? Okay. All right, great. Thanks so much, Tom, for coming along. It's quite short
Thanks,
notice.
everyone.
I know you've probably been presenting on this about everywhere. So, yeah, thank you for coming along. Much appreciated.
Yeah, I hope I've not presented to too many people on here 2 or 3 times now. But yeah, if you have any questions, do get in contact with us, because we'll be happy to help. Thanks.
Great. Nice one. Thanks, Tom. So that's all the presentations for today, but we've got a bit of time left, so this is we sort of usually open the floor up at this point. So if anyone's got anything they want to share, any sort of piece of work they're working on that they want to share with the group, or if anyone's got a question they want to put to everyone on the call, something they might be struggling with a particular resident maybe, now's your chance to come in. So yeah, feel free to jump in and put your hand up. I actually have something I was going to share if no one else wants to come in. In a couple of weeks' time, at this tool session, one of the items we are possibly going to look at digital inclusion, because the government have launched a digital innovation fund which local authorities can apply for. It could be quite a decent sum if we were successful. So we want to speak to community partners and people who are working with digitally excluded residents to understand what might be most helpful. So if that's kind of an issue which you have a particular interest in and you want to kind of share your insights, then we will probably be having a sort of discussion on that for 15-20 minutes next fortnight on the 21st. So do come to that one if you want. Krista.
Hi, just leading on from what you were just saying, John, we're doing a big thing at the new hub in Digital Inclusion Week in October, partnered up with Homerton and the digital team over there, and a couple of other digital projects that I've brought in. So we're going to be doing like 2-3 days of events at New Kingshold during that week. So I don't know if the council will have a think and maybe partner up with us on something. Can you guys come down and do something on a day with us, or tie something in together or whatever? But just letting you know.
Yeah, sounds great. Do you want to send me the info on email, Kristen? And we can.
Yeah, I'm putting it together next week, so the flyer and all that. So
is that with Emily May?
Yeah, with Emily, and then but I'm also working with a team from Newham and a team from Tower Hamlets as well that are part of the NHS. Cool. So it's because they're all doing different things. Yeah, so we've brought them in and we're doing like different workshops. We're putting a plan together this week, which we'll put out next week. So yeah, I don't know if the council want to think of doing something on that with us or whatever. More than welcome.
Cool, sounds good. Thanks, Krista.
Yeah, or whether it be part of a bid, I guess. A cooperative bid if there's stuff that.
Hi, Jen.
Hi, sorry, I didn't put my hand up. That was really rude. Hi. Lovely to see Chris. It's like seeing you two back together again. Claire and
we're seeing it with Databank. So we're part of National Databank. So anyway, as an organisation, Closet's been part of that for a couple of years. So we've doing an event in partnership with them for Digital Inclusion Week. So we've brought in various different community projects and NEL partners. But if the council want to get involved and come partner up with us and do something on a day, you're more than welcome.
On the day, and maybe for this bid, maybe a collective bid, because I think this thing that the Digital Innovation Fund, there's some funding, isn't it, John? I think.
Yeah, something I heard about it. Yeah, no problem. Anyway.
Sorry, it can be either something which is tried and tested and it's sort of under their best practice sort of umbrella term or whatever, or it could be something that's innovative and new. So yeah, there's definitely scope for collaboration and seeing what would work best. So yeah, again, if you do want to come along in a couple of weeks' time and feed into that discussion, then please do.
Drop me the invite so I don't miss it. Yeah, because I get so many meetings and I don't go to them.
It's just the same meeting as this. It's just this meeting.
Cool.
It's just meeting in 2 weeks' time.
All right, cool. Thanks, John.
Nice one. Batia?
Hang on a minute. Struggling here. 2 things. One, digital accessibility. There must always be a channel for reasonable adjustments somewhere in there. I mean, obviously, I have my own particular view, but generally what I say is, whilst it's grand to have the digital projects and to be handing out SIM cards and so on, but a mobile phone is too small. I can't read a screen on the mobile phone. So it's no good telling me to use an app because I can't actually see the fields to fill in anything on the app. If I blow it up too big, I end up with half words. The other thing I want to shout out about complete change of subject, I've had some very interesting conversations with Christina, the Universal Credit Coach. Yeah, and I want to bring up 2 points that might trip people up, because I got tripped up. One is if you ask for alternative frequency of payments, generally the language used is, oh, you can ask for fortnightly. That fortnightly doesn't mean 2 weeks. What the DWP does is they give you half your universal credit on the due date, and they make the second payment 15 days later, regardless of the length of the month. You can, which it is often said, you can have it 4 times monthly, but then they do the same thing. They give you the first quarter and then they issue the other ones every 8 days thereafter. Where people will fall into difficulties is, even though you use that arrangement for your money, great, your housing element will always come in one chunk once every calendar month. And that is where every social tenant, it may fall into difficulties. If your rent is monthly, it's not a problem. But if your rent is weekly, it's quite difficult to reconcile the amount you get once a calendar month with the amount that your landlord may well be expecting every week. I hope that helped people. I'm not sure that I was clear, but I hope it helped.
Thanks, Patsy, for those 2 points. I'm wondering if that's something we can share with the UC, anyone who's involved in the UC work, Rachel. But yeah, thanks, Patsy, for those 2 points. Anyone else have anything they want to share at this point? Jenny?
Yeah, I was thinking, as you mentioned, the next session. I don't know if we've heard back from them yet, but we were looking to plan a session on modern day slavery. And we have reached out to Hestia, who are one of the providers locally, working on that. And I guess it's a real priority for so many different services, because modern day slavery cuts across sort of children's services around child exploitation and trafficking, but also the ways that people are indentured into work and lots of different spheres it sort of impacts on. But in terms of our role as a sort of first responder, to supporting those who've survived experiences of modern day slavery, we wanted a training in this space, really, to kick off a conversation to understand what the picture is in Hackney, what the insight is from those who might be working with or have worked with survivors of modern day slavery, so we can begin to sort of have conversations about what a strategy locally needs to look like. There needs to be a review of the strategy, and we've got a new safeguarding chair. So there's an opportunity, I guess, to use this space to get insight from anyone who might have been working with people who've survived modern day slavery, but also to understand more and raise awareness and understand more how we can notice when somebody might be in that position, or what might they need and what are their rights, and which are the organisations that might be able to help them. So if anybody on this call has any experience of working with survivors of modern day slavery, or anything they think they'd like to share with this group, or then let us know. But we'll be running that session. We'll do it like a mini training, and it might help us to sort of co-design what a training could look like for services, to make sure that we're all aware of our responsibilities, but also how we can help people in those situations, and how we can recognise it, because I think there's a real lack of awareness of what support is available to people to get out of those situations, and obviously people in those situations are some of our most powerless in the community, and they may well be coming for food support or accessing some of the services that you're connected to, and I guess those are always opportunities to notice and to plug people into the right services. So we thought it was about time to bring that here as an item. Then there was another point, but I want to let those who have their hands up, I'll come back after the others.
Thanks, Jenny. Batio, I'm assuming that's a hand from before, so I'm going to go to Gitty.
Hi, it's just again about the care charges that we discussed earlier. It's just that, so the way it works, the way we believe it works, is that somebody with under £6,000 in savings doesn't have the care charges. But if you've got between 6,000 and 23,000, you get a reduced rate, and from 23,000 you pay the full rate. However, the thing is that many of these care users are not working, And this £23,000 that say they do have in their account this is like all of their savings and it's their pension, and they kind of spend it within the year on care, and then they're left with absolutely nothing. So that poses to be a very big problem, because they're left absolutely penniless just because they've got this savings and this is the rule, which makes sense. But I was just wondering if there's something could be done about that.
Unfortunately, obviously, Ramika isn't on the call anymore, but yeah, I can totally see where you're coming from in terms of they might have savings that would probably be whittled down fairly quickly, but low income. So I'll just be honest, I'm not an expert in care charges policy at all, but maybe if you want to email me, Getty, I can try and pass that on to Ramika.
Would you give me her contact detail in the chat?
Yeah, sure. I think it's in the, I think there's a, let me try and look online, because I think there's an inbox for that team. In terms of sort of wider financial crisis support, do you know where to turn for that in terms of those residents?
We do, but I'm just saying that we're seeing that this is a big source that we can work with prevention, rather than, you know, them spending all of their savings and then seeing that, you know, they haven't got anything to live on.
Yeah.
If you reach out to me, Getty, I can also discuss some community specific remedies which may help people.
Fantastic. Would you give me your email address in the chat?
Yeah.
Great, thanks, Batia. Oh, thanks, Charlie. You've already put it in there. Yeah, we've just put the email address as well for you, Getty, as well for the care charges team at Hackney.
Thank you.
No worries. Jenny, did you want to come back in?
Yeah, I guess it was just using the opportunity to ask the group if there were particular services or issues that you really would like to know more about, so we can continue to try to curate these sessions with the most useful information. It's been such a brilliant session today. There's so many really practical things. Thanks so much, Batia. That's just, I know that this recording of this session is something we can now share with people who can also make use of it. So I guess what we capture in these sessions is for those of us that are able to make it online, but also those that watch the recordings later, and that we can raise awareness. So are there any issues that feel like really pressing that you wish that you knew more about in your work of trying to support residents more preventatively? Are there any gaps? Are there any services you think, oh, I don't know how to get hold of support from someone in this situation, or I don't know what's available on that? If you do have ideas, you don't have to think about them now, but please do always remember to email us and let us know, or if there's services you think we should ask to come and present, or that you want to ask to come and present, because we always want to make it as useful as possible to you all. And I guess on that, I did want to say, John, and we haven't spoken about this, but I know that it's something we're always talking about, this group being more involved in sort of steering this session, is that I know I spoke with Josie Crisp, who often attends the session from housing, about just getting people who want to be more involved in steering it through a steering group more involved. And so we're meeting up with Josie, John and I next week anyway, to kick off the conversation. But anybody who would like to be in a small group of us who steer this session, and who attends, and what we do with it and how we grow it, do let us know, because we'd really love to kind of work with those of you who are working out in communities and working directly with residents to make sure that this is the most helpful space, and that we're thinking about all the things we need to do in terms of how it could be most helpful. So just let us know. And if you've got any ideas, shout them out now, or email John, or email any of us and let us know, because your insight in this space is always just as important as the things that get presented, is hearing from you about what's happening on the ground and what you need most. So so we're always curious to hear from those who aren't presenting. Oh, Getty, yes. So John Davis's email, I think john.davis@hackney.gov.uk, but also any of us in the team. There we are. Rachel Salmon, we've got Chanel on the line as well. I think we do even have a shared mailbox now, don't we? And Charles, we've got Charlie on the line as well. So any of those in the team that if you've got ideas, let us know. And if you want to be a part of a small group steering this, it wouldn't be a big time commitment, just meeting now and again online. And if you think you could spare half an hour for that, we've got Maddie also in our team on the call as well. So yeah, continue sort of letting us know how it can be most useful, and anything you want to hear about here. And please do come and present if you haven't presented on what your service does. We're a friendly bunch and we love to hear all about all the great work you're doing. So don't forget to come and do your 20-minute slot as well, because or 10-minute slot. So then you can also share that video recording as well when it's online. Did anyone have any ideas about what you want to see more of here? Yeah. I know you've got a forward plan, haven't you, John? Should we recap on what we've got on there? Oh, you're on mute.
So let me just have a look. Definitely, as I said, definitely next week we'll be talking about Digital Inclusion Fund and possibly one-day slavery. Just trying to see if we've got anything else planned ahead of that. 4th of September, Helen is coming along from Bags of Taste to talk about their work, but that's the only other thing that we've got definitely booked in. So there's lots of space for people to suggest things or to present themselves. So yeah, just give me a shout.
Yeah, please let us know. Oh, and I also wanted to give a shout out for some work. I don't know how many people on the call are working supporting families who are living in temporary accommodation in Hackney, but we do now have a drop-in that takes place every fortnight. It is taking a bit of a break, but there is one on Monday at Rowley Gardens near the Edge Youth Club. And Playbus are working on delivering that alongside Hannah in our team and lots of other frontline services that are there supporting families with lots of equipment to play. So the children and families are able to play and just enjoy some fruit in the sun and chat. And you've got people there from occupational therapy now. You've got Here to Help come down there. There's housing, the health visitor. So these parents can get time, and an immigration advisor as well. So these parents are getting a really great wraparound support service there to understand and unpick some of their needs. And we know that families living in TA have lots to deal with in terms of the complex system. So if you are working with anyone, any families that are living in temporary accommodation you think might benefit from that, Hannah in our team has the details of the next sessions. I know, there's another one on Monday, and then there won't be one again until September the 11th. But the idea is that they will continue, and they're taking a similar format as the Welcome Hub at CLR James Library, or every other Thursday, that really tries to provide that wraparound support, but in quite a trauma-informed setting where everybody can feel really comfortable. And I've been down there, and it's a really wonderful environment to get support. So we'll keep telling you about that, but you can note that one. Thank you. That's enough from me.
Thanks, Jenny. Anyone else with anything to share before we close the session? No? Okay, well, just do, as Jenny said, do get in touch with any of us. If you have ideas or anything you want to hear about at these sessions. Thanks, Kitty. And great to have you all on the call, and see you in a couple of weeks, hopefully. Bye.